Well, good morning. If everybody is here, we'll go ahead and get started. Hello, everyone, and thank you for the opportunity to present today. My name is Nicole Brock, and I'm passionate about leadership in healthcare, not only delivering results, but also caring for the well being of the workforce. Today, I'll walk you through a leadership model that I developed called the CARE Leadership Model that addresses a critical issue within the healthcare organizations, which is mental health in the workplace. I'll cover this issue itself, the leadership model, strategies for adoption, stakeholder engagement, evaluation methods, and the expected organizational impact. Okay, so let's take a moment just to identify the healthcare issue. So, during a stakeholder interview I had with an operations manager at Amazon's Leave and Disability Division, one key issue that stood out was mental health. Employees are facing high levels of stress and burnout with limited systems in place to support them. And this is not just unique to Amazon, it's a widespread issue in healthcare. Left unaddressed, it can lead to absenteeism, turnover, decreased morale, and ultimately affect patient care and organizational performance. So, to proactively address this issue, I have created the CARE leadership model. CARE stands for collaboration, adaptability, responsibility, and ethics. Um, Principles inspired by leadership theories such as transformational, servant, and adaptive leadership. The goal is to shape a leadership culture that is inclusive, flexible, has accountability, and ethically grounded, particularly in addressing the mental health needs of healthcare workers. All right, so on this slide, I'd like to take just a brief moment to break down the components of each element of the care model. So, each element of the care model is designed to strengthen organizational support for mental health. So, let's first take a look at collaboration. So, collaboration encourages cross functional engagement in mental health planning. Adaptability allows leaders to pivot based on evolving needs and employee feedback. Responsibility makes mental health awareness a core leadership duty and not an afterthought. And then last, ethics reinforces trust and inclusion, creating safe spaces for mental health conversations and actions. So I have a couple additional examples here on my slide. So again, starting off with collaboration, we have that it breaks silos, promotes teamwork across departments. Adaptability responds to feedback and changes needed. Responsibility is accountability for staff mental health awareness. And then ethics is a fair, transparent, stigma free policy. So, again, these are all of the components that build our CARES model. Okay, so at this point, you all are probably thinking, like, wow, like this CARES model sounds great, but how do we incorporate this into our organization? So, here on this slide, I just wanted to take a moment to provide you with the recommendations that I believe would help bring the CARE model into practice. So, to bring the CARE model into practice, I would recommend first starting off with leadership training. So, leadership training would integrate CARE principles into the onboarding and professional development process right out the gate. Second, policy integration. So, align the HR and wellness policies with the model's values. So, if they are reflective of each other from the beginning, I think that that is a key way to go ahead and get this incorporated in your organization. Three, pilot programs. So start with small groups, test the model in one department to measure its results, and then begin to make fine tuning before scaling it out to everyone. So this way we can get like any errors or any just like tweaks that we need to make to the models in the program before we roll it out to the entire organization. And then four, which I think is very important, is a great communication campaign. So promote the model with consistent, clear messaging throughout the whole organization. So whether that's via email, posters, flyers in a break room, like letting everybody know that this great model is about to be presented and actually circulating through our organization. Okay, so to continue from the previous slide, I did just want to provide you all with an example of what the communication campaign could look like. So on this slide, I'm sharing an example of what our internal communication campaign could look like to introduce and promote the care leadership model. So the campaign is titled Care for Mental Health, which directly ties our leadership values to the issue we're addressing, which is workplace mental health. Our slogan is collaborate, adapt, take responsibility, and lead ethically. It's simple but powerful while reinforcing our model with every communication touch point. So we would launch this across multiple internal channels, such as emails from trusted leaders, physical and digital posters in break rooms and lounges, stories in our monthly newsletter, and even short staff video features showing how employees are supportive of one another. The goal is to normalize the conversation around mental health while making it clear that care is a framework we'll use to drive support, trust, and accountability. This campaign is not just a one-time rollout. It would evolve over time with feedback, employee spotlight, and regular engagement metrics to assess its reach and impact. With our core message being that mental health is a part of our organization's well-being, care leadership will guide how we support one another, and everyone has a role in building a compassionate culture. Okay, so next on this slide, I would like to take a moment just to highlight and identify a few key stakeholders that are crucial to this model's success and their position as far as like what they bring to the organization to be able to enforce this model. So first, starting off with executive leadership. They allocate resources and lead by example. Human resources and mental health teams align organizational practices and benefits. Frontline managers lead direct teams and influence culture. Employees, essential to feedback loops and long-term engagement. And then I also would like to note that occupational health professionals, DEI officers, and even union reps could be beneficial when needed. Okay, so great. Now we have identified our stakeholders, but how do we get our stakeholders to buy in? So let's address that on this slide. So stakeholders buy-in about inclusion and alignment is very important to the care model. So I suggest that one of the first steps that we do is early engagement. Involve them in the development and the rollout. This will be crucial so they can feel a part of this new transition that is coming into the organization. 2, data and storytelling. Share statistics and real experience to illustrate the need. So then this is the visual piece of it, providing them with some visual context. 3, co-creation workshops. Build ownership and ensure relevance. Very important. And then lastly, show return on investment. Highlight how addressing mental health improves retention, performance, and costs. Because in the end, this will benefit all departments, not just the whole organization, but even individual departments when they can see how when not addressing these issues, it impacts their areas too. Okay, so to truly know if the care leadership model was a successful implementation into the organization, there would need to be some type of evaluation plan in place to confirm that. So on this slide, I'll be addressing the metrics that I believe we could use to ensure that it is in fact working the way that we believe that the care model would work, and then also, how we would be able to find any type of areas of improvement. So evaluation ensures our model isn't just symbolic, but it actually delivers. So first, using the leadership practice inventory, we can assess leaders' behavior aligned with care. Next, we can also track employee surveys. So comparing pre and post implementation mental health perceptions. We can also use utilization rates. So for example, are employees using the available support? Is it a utilization rate that we could look at? Next would be retention and absenteeism. Is there trends in turnover, sick days, or leave days? And then last, feedback. So through 360 reviews and engagement forums, we can have those open conversations about if employees are feeling as though this CARES model is actually effective. And again, it's delivering the support and care that we want to have within our organization. All right, so next on this slide, I would like to discuss the anticipated organizational impacts. So by adopting the CARE model, we expect several key benefits. The first one being improved processes. So improved processes such as streamlined access to mental health support. The next benefit we expect to see is increased motivation. When the staff feels cared for, they're more engaged. Next, better relationships as trust grows between colleagues and managers. And then lastly, open communication. Normalizing mental health discussions creates psychological safety. And then just to point out a couple things that I have here on the slide that tie into some of the key points that I pointed out previously. Better processes for support and referral, increased motivation and morale, strong peer and supervisor relationships, and then transparent communication channels. So let's now look at the broader organizational outcomes. So on a broader scale, care actually impacts the entire organization. So starting off with quality of care, emotionally supported staff give better care to patients. Performance, fewer distractions, higher productivity. Financial outcomes, reduced disability claims and lower turnover. And then lastly, change readiness. A leadership model like CARE promotes a flexible, resilient culture that can handle future disruptions, a culture that is resistant and adaptable. Okay, so we have reached the end of today's presentation. In closing, I just would like to reiterate the CARE leadership model offers a clear, people-centered, and evidence-informed approach to supporting mental health in healthcare organizations. Through collaboration, adaptability, responsibility, and ethics, leaders can foster a resilient workforce and a thriving culture. I'm excited about the opportunity to bring this model to life and to lead a meaningful change within your organization. All right, and then just on this last slide, I wanted to point out these are the references I used to develop this model and presentation, including foundational leadership theories, mental health data, and course-related resources. All sources are listed in APA format for you to view if you want to check out the references that I provided today. And again, just in closing, thank you so much for this opportunity. I look forward to hearing back from you all. If you have any questions or concerns about any of the information that was presented today, please do not hesitate to reach out. I also provided a copy of this presentation to the receptionist when she was setting up my interview. So you guys actually already all have a copy of this as well. And thank you. I appreciate the time today. I hope you all have a great rest of your day, and I look forward to hearing back from you for the potential opportunity to be a part of this amazing organization. Have a great rest of your day. Bye.